In this series of videos, we'll discuss how to combat weight bias and stigma in your research, clinical practice, and everyday experiences. I have 3 learning objectives for this topic. In this video, you will learn about how to identify and challenge explicit and implicit weight bias. We all have implicit biases. Unfortunately, they come from deeply ingrained societal messages and ideas about body shape and size that can influence our automatic thoughts and reactions to others. One of the most important things we can do is to work to recognize these biases and become more aware of when and how they manifest. Do you see an individual with a larger body and reflexively assume they are inactive, have health problems, are not motivated? Do you see an individual with a smaller body and reflexively assume more positive things about their lifestyle, motivation, and health behaviors? The first step is to bring mindful awareness to these biases. Acknowledge and accept these thoughts, but then choose to counteract them with more neutral and inclusive thoughts and actions. Explicit and implicit weight biases can negatively affect our interactions with others. When healthcare providers hold these biases, they are more likely to assume that individuals with larger bodies are lazy and lack self-control and willpower. They may believe these individuals are personally to blame for their weight and will be less likely to follow through with their prescribed treatments. They may even believe that these individuals do not deserve the same quality of care as individuals with smaller bodies. When healthcare providers hold these assumptions, their patients report they are less empathetic and less thorough in their evaluations. They are more likely to attribute health problems to the patient's weight, even when it's not a weight-related health problem. Overall, these patients feel they receive poorer quality of care when their healthcare providers have these biases. Let's discuss some ways you can address weight-related bias in your experiences and practice. The first step is to raise awareness, both your own and others. You and your colleagues can commit to take an implicit bias test to assess the degree to which you hold these biases and the degree to which they affect your reactions to different body shapes and sizes. You can also continue to learn about what implicit bias looks like so you are more prepared to identify it in your own experiences and interactions. Second, you can reflect on your own behavior. Become self-aware of what stimuli and context elicit your own explicit and implicit biases and assumptions. This self-awareness will help you identify where you can work to become more sensitive and inclusive in your practices. Third, you can learn more about individual and group differences. By better understanding the individuals and groups with whom you work, you can challenge your negative stereotypes and rewrite the scripts that may lead to discrimination and stigmatization. For example, seeing examples of individuals with larger body sizes who are extremely athletic or have healthy metabolic profiles will help you appreciate the different ways that individuals can look and be healthy within their own unique contexts and experiences. Fourth, plan ahead for situations where you may be prone to impulsive reactions or biased decision-making. Then, create structures that will help you overcome your assumptions and be consistent in how you assess and work with different individuals. For example, within a clinical setting, a doctor's office could have prepared scripts that guide clinicians through conversations about patients' weight status classifications, as well as standardized protocols that guide follow-up assessment decisions when an individual is assessed to have a BMI classified in the obese category. Fifth, you can build partnerships with the affected population to avoid the expert trap and messaging that may be misaligned with needs and experiences. Make sure that you give a voice to key stakeholders who can best guide your practices to help you be evidence-based and effective. Finally, find the courage to speak up when you see bias in your experiences and interactions. Find tactful ways to help and educate others who are expressing explicit or implicit biases. Whenever possible, replace discriminatory or stereotypical messaging with inclusive, evidence-based information to ensure that you are not inadvertently reinforcing weight bias and stigmatization. And remember, weight is just a screening tool. It is a useful metric, but there are many other things we need to know before we determine an individual's health risk and need for intervention. We want to be sure to follow up this weight assessment with further assessment of metabolic health and open-ended questions to assess weight-related behaviors, motivation, readiness to change, and barriers to lifestyle change. We do have more robust measures that give us a clearer picture of an individual's health status and risks. So we want to be sure to also measure body fat, blood lipids, and glucose regulation to assess the individual's metabolic health. And we definitely want to assess and not make assumptions about health behaviors and contributors to weight status. We want to take the time to develop a comprehensive understanding of an individual's biological propensity toward weight gain, as well as more modifiable factors such as dietary and physical activity patterns. We also want to appreciate social contextual factors such as the individual's stress levels and context within which they live and work. All of these factors will help us work with patients to more effectively identify the most promising pathways to improved health. And finally, we need to remember that health comes in many shapes and sizes. Our goal is not to mold our patients into body ideals. Instead, we want to appreciate each individual and their strengths and limitations to find the healthy lifestyle and weight status that works best for them. Let's review some key takeaways from this video. There are many ways we can identify and challenge explicit and implicit weight bias to ensure we are sensitive and inclusive in the work we do. Some strategies include raising awareness of when and why bias occurs, reflecting on stimuli and contexts that trigger our biases, learning more to challenge our negative stereotypes, creating structures that reduce our reliance on biases for decision-making, engaging effective populations as valuable partners for improving our understanding and practices, and speaking up when bias is expressed to break the cycle of weight bias and stigma, reinforcing more weight bias and stigma. That's all for this video. Thank you for learning with me.